The number of people dying in emergency rooms is on the rise across Atlantic Canada. It has reached a 6-year high in Nova Scotia. Last year, the number of deaths in ERs increased by more than 19% in Nova Scotia and about 4% in New Brunswick. The number of deaths did drop slightly in PEI and Newfoundland, but they are still high compared to pre-pandemic levels. So joining us this morning from Air Chat, Nova Scotia for a closer look is Dr. Robert Martel. He's a physician who worked in ER departments for more than 30 years. Welcome to the show.
Good morning. Thank you for having me.
My understanding is that this is due in part to something called bed blocking. What is bed blocking, and why would it be leading to more people dying in ERs?
Okay, bed blocking is a term used to describe the environment in emergency rooms today where individuals are unable to leave the room for several reasons. One is that there is no room upstairs in most hospitals because individuals are unable to access long-term care, or they're unable to be discharged home because the ability to provide care at home by family is not there. So these individuals end up staying longer than they should in emergency rooms, cared for by emergency room physicians who are really not in a position to be able to provide the care that they require.
According to the Our Care initiative, by 2023, about 6.5 million Canadians do not have access to a primary healthcare practitioner. How does that factor into the problem that you're reporting?
Well, I think you have to understand this on looking at the continuum of care from pre-hospital right through to definitive care on the floors of various specialties in hospital. And the pre-hospital environment has been very challenged, not only with the lack of primary care physicians, but also challenges in providing first responders and definitive ambulance response times. But primary care is really a big problem today, and this is a result of very poor planning over the years, cutting of training positions and not preparing for the eventual tsunami of the aged population that we have to deal with. So we have long wait lists. We have problems accessing care. Some people are waiting 6 to 8 weeks for a primary care appointment. And as a result, you're ending up with individuals much sicker than they should be in the emergency rooms. And as a result, you're going to get individuals dying because of that event.
Dr. Martel, you brought up age, which leads to my next question. On average, people in Atlantic Canada we know are older than the rest of Canada. How are the higher numbers of ER deaths connected to healthcare problems in the region in general?
Well, we have the third oldest demographic in the country. So these individuals are suffering from chronic illness and age-related illness, but also Atlantic Canadians are not known for their healthy status. So the lack of access to primary care has just made that worse. Conditions like diabetes and heart disease, if not treated in the appropriate way and the appropriate time, end up with complications, and these individuals are overrepresented in the elderly. So as a result, they end up with presentations which are very complex, a multi-system, and emergency rooms are not designed to manage those.
Right.
My training and other emergency rooms people are trained to address a particular complaint, correct it, or move it on to somebody with more skills than the emergency room. And so as a result, we end up with people staying much longer than they should and being much sicker when they arrive.
Dr. Martel,
so these numbers regarding higher death rates are no surprise. It's just the reality of the situation that we find ourselves in today.
It is, well, as you say, it's an inevitable outcome, but it is a heartbreaking one. And of course, in Atlantic Canada, they're not the first ones to send out this cry. We saw letters like this coming from BC last year as well. Dr. Martel, thank you so much for coming on today. We appreciate it.
Well, thank you for having me.
Hey, thanks for watching. If you liked this, be sure to subscribe here, or you can check out more Your Morning videos right here.